the best of the week on Relevant Radio.
My guest today is Dr. Tabatha Barber. She's a triple board certified obstetrician, gynecologist, and a functional medicine doctor. Dr. Barber, you said something that I just have never heard it said this way. You said gut health affects pelvic health. No one ever says it like this. And you tied it into endometriosis, fibroids, and fertility. How is that all connected, and why don't we hear about the connection in this way?
This is the most important thing some women are going to hear today or all year. And I didn't understand this as an OB-GYN surgeon. That's the saddest part is I did robotic surgery 3 to 5 times a week. I did stage 4 endometriosis cases, severe large fibroid removals and hysterectomies for these things. I would spend hours peeling the bowels away from the ovaries, tubes, and uterus. I was dissecting them off, trying to carefully keep the bowels safe and not injure them because they would get scarred to the pelvic organs. And as an OB-GYN, I was trained and taught that the endometriosis or the fibroids were causing this scarring to happen, when in fact what's happening is we have chronic gut issues that are seeping chemicals into our pelvis, and that is where the scarring is starting and the pelvic dysfunction is starting. So our gut issues are actually driving our GYN issues. And I didn't understand that as a surgeon. But looking back now, it all makes so much sense, because when we have infections in our gut from the wrong bacteria and yeast and parasites, they make little chemicals and toxins, and they seep into our bloodstream, and they seep through the walls of the colon into the pelvis. And there's no compartments. Some people don't realize that our bowels literally lay on our pelvic organs. So your uterus, fallopian tubes, and ovaries are touching your bowels and colon all the time, and your bladder. And so they are sharing these inflammatory responses, and what's happening in our gut is driving our pelvic disease. And so I would get so frustrated and sad as a gynecologist because I would spend 3 hours doing an endometriosis case where we would clean up the pelvis. That's the language you use for getting rid of scar tissue and endometriosis. And then we'd put you on a suppressive drug to stop you from making your hormones, and it doesn't really work. And so then you got to have another surgery within a year or two, and you're just stuck in this vicious cycle of pain and surgery and infertility, when all along we needed to be treating your gut and not doing all that other stuff. And once I realized that, I just felt sad for all of the women that I thought I was helping when I really wasn't. And I don't even want people to be mad at their physicians. That's not how we're trained. We don't know the root cause of why disease happens. We're trained in getting rid of symptoms and managing disease. And so if anybody here has been struggling with anything in the pelvis, irregular periods, painful periods, severe PMS, fibroids, polyps, endometriosis, repetitive ovarian cysts, people end up in the ER over that stuff. You have to evaluate your gut. That is driving these processes by and large.
Wow. Just to hear that, especially as your experience as a surgeon did you have this gut feeling as you're sitting here treating and working and, as you say, peeling back and doing these pelvic treatments? Did you have a feeling there was a connection that wasn't being made? What led you eventually to root out and see that gut health cause impacting pelvic health?
Yeah, on the more severe cases, at one case in particular, I remember there was just exudate on the bowels, meaning it looks like an infection lying on top of the bowels. There's pussy white stuff that shouldn't be there. And I just thought, is this why she's got so many pelvic issues? Is it that she's got a gut infection? And I couldn't get the gastroenterologist to back me on this and help me figure it out. And at the time, I didn't know about stool testing or functional medicine. And so I couldn't pursue it really because they shut me down of no, she's fine. That's not the issue. But that day, I just kind of like felt like there's more to the story here. And so when I took my first functional medicine class, the first thing they talked about was your gut health determines your overall health. And I went, oh my gosh, this has been the missing piece all along. It makes so much sense.
And so many people get annoyed. They say, okay, you're going to tell me again how to eat. So what do you do? I think one of my questions is, do you have to have the surgery still for the endo, the fibroids, all of this? Can that go away with healthy eating? Does it go away, or is it just diet? What's the approach?
So everyone is an individual, and it really does matter how severe your condition is, how long it's been going on, what interventions you've had, and how healthy or unhealthy your gut really is. I would say at least 80% of the women I take care of, they shift just with diet alone and some supplementation. And then the other 15 or 20% need to go on and do actual stool testing because there's actual infections that need to be killed off, or there is leaky gut that needs to be healed, which is called intestinal permeability in the medical world. Or there's an immune response that needs to be taken care of, and women develop food sensitivities from this inappropriate immune response in their gut, and those things have to all be dealt with. So that's what I typically do in my virtual medical practice is we do a comprehensive plan to evaluate what is going on in your gut, what's your immune system reacting to inappropriately, how can we remove those triggers and allow for full healing. And that is, I would say, the biggest game changer for women. So a lot of women are out there trying to do it on their own, and for some women it works. But if you've tried all the things, you probably haven't done functional stool testing with an expert who knows how to actually shift your gut health and, help you reverse these diseases.
You can join me and listen on the Relevant Radio app to Trending with Timmerie live each weekday at 6 p.m. Central. Thanks for listening.